Hello, I'm Farha nausheen of Group 316 and the topic is pressures in the body. The human body experiences various types of pressures that are crucial for its proper functioning. The major types of pressures are pressures in cardiovascular system. Cardiovascular pressure refers to the pressure exerted by circulating blood against the walls of the blood vessels, primarily arteries. The systolic pressure, the pressure in arteries during the contraction of heart, high number of blood pressure. The diastolic pressure, the pressure of arteries when the heart is at rest between beats, lower number in blood pressure. Mean arterial pressure, an average pressure in a person's arteries during one cardiac cycle calculated. Proper cardiovascular pressure is essential for adequate blood flow to organs and tissues. Abnormal pressures can indicate conditions like hypertension or hypotension. The second pressure is hydrostatic pressure. Hydrostatic pressure is the pressure exerted by a fluid at equilibrium due to the force of gravity. Role in circulation. The blood circulation hydrostatic pressure helps drive blood through capillaries, influencing filtration and reabsorption of the fluid. Starling force. Hydrostatic pressure works alongside osmotic pressure to regulate fluid exchange between blood vessels and surrounding tissues. Clinical relevance. Changes in hydrostatic pressure can lead to conditions such as edema when excess fluid accumulates in the tissue. Bladder pressure. Bladder pressure refers to the pressure within the urinary bladder as it fills with urine. Normal function. As the bladder fills, intravesical pressure increases. Signaling lead to void. Retrosor muscle. The bladder's muscular wall contracts during urination, increasing bladder pressure to expel urine through the urethra. Clinical importance. Abnormal bladder pressures can indicate conditions like urinary retention, overactive bladder, or bladder outlet obstruction. Respiratory pressures. Respiratory pressures are the pressures that occur within the thoracic cavity during breathing. Intrapleural pressure, the pressure within the pleural cavity, which is usually negative relative to atmospheric pressure, helping keep the lungs inflated. Intra-abdominal pressure, the pressure within the abdominal cavity that can affect diaphragm movement and lung expansion. Lung volumes. Changes in respiratory pressures facilitate inhalation and exhalation. Clinical relevance. Abnormal respiratory pressures can lead to conditions such as pneumothorax or respiratory distress. Foot pressures. Foot pressures refers to the distribution of pressure across the foot when standing or walking. Pressure distribution. Different areas of the foot experiences varying levels of pressures based on body weight and posture, affecting balance and gait. Foot health. Abnormal foot pressures can lead to conditions such as plantar fasciitis, bunions, or diabetic foot ulcers. Assessment tools. Devices like pressure mats or insoles can be used to measure foot pressures for clinical assessment and orthotic design. Eye and ear pressures. Eye pressure. Intraocular pressure is the fluid pressure inside the eye. Normal range. Normal range of intraocular pressure typically ranges from 10 to 21 mHg. Clinical importance. Elevated intraocular pressure can indicate glaucoma, which can lead to vision loss if untreated. Ear pressure. Middle ear pressure refers to the air pressure in the middle ear cavity. Eustachian tube function. The Eustachian tube equalizes middle ear pressures with atmospheric pressure crucial for hearing. Clinical relevance. Eustachian tube dysfunction can lead to conditions like ear infections or barotrauma during altitude changes. Understanding these pressures is essential for diagnosing and treating various medical conditions effectively. Thank you for listening. Hope you understood.